He's not running for Congress. House of Delegates member Chris Stolle, he represents Virginia Beach. He's a Republican. That's the 83rd District. If memory serves me correct, I didn't look it up. I hope I have it right. Delegate, thanks for being with us.
Hey, how you doing, John? I'm glad to be here today.
Okay, now, always a pleasure to have you on. I just wanted the first elephant I want to get out of the room. I had called you a week ago at home when I heard that Scott Ridgel was not running for re-election. I thought that you would be a serious candidate for Congress. You told me the other day and sent an email out that you had decided not to run for that seat. Can you just explain that thinking to our audience?
Yeah, John, just for this type of reason, I think there's so much going on at the General Assembly right now. I'm on Appropriations Committee here. This is a budget year. We have important issues coming up in healthcare and transportation, really things that dramatically impact Hampton Roads, the 83rd District. And, my obligation is to take and focus on those things and not what may be coming down the road. And I think that, just as I said in my email going out, that any consideration of a congressional run right now would distract from what we're trying to do in the General Assembly for the next 2 months.
Well, look, you've got a lot going on, and I have to say that I talked to Cindy, your legislative assistant, yesterday. I read your email not once, not twice, but 3 times, and I really commend you for that because, it's easy to jump at the next shiny object, but I was very impressed with the level of your sincerity in, saying, look, I can get more done in the position I'm in now for my constituents than I could ever do in Washington. So I think that says a great deal about your emphasis on some of these issues locally, sir.
Well, thank you very much. I really appreciate that. And I know that whenever a politician sends something out, everybody has to say, well, what's the real story behind it? That is the real story behind it.
Well, I did get the thing, and I did read it 3 times. And the first time I read it, I said to myself, what's the real story behind it? Let me read it a second time. And then by time number 3, I said, well, he's just the real deal. That's the bottom line, and that's why we're excited to have you on today. Delegate Stolle, you've got HB 1083. I don't like to get into numbers, but this has to do with the Certificate of Public Need, COPN. Now, look, there's a movement underfoot within your Republican caucus right now to repeal what is called COPN, the Certificate of Public Need, which basically restricts other hospitals from encroaching or medical companies from coming into certain areas that are encroaching on hospitals. And the argument that we've been getting from some of your colleagues is, well, we need free market competition. But I am opposed to repealing COPN because here's the bottom line. Healthcare, Dr. Stolle, is not a free market. Medicaid and Medicare have been in existence for 5 decades. The federal law requiring this is a federal law requiring hospitals to provide indigent care, emergency room care, regardless of a patient's ability to pay, is 3 decades old. I mean, these are clear examples. Government is involved in regulating healthcare and hospitals. Look, if you had an automobile dealership and somebody came in to buy a car and they didn't have credit, they had no money, if you were under the hospital regulations, you would have to give that person a vehicle because the government says, well, they need the wheels to get to work and take their children to soccer practice, so they have to have a vehicle. Nobody could stay in business for a week that way. I don't see how this makes any sense.
I absolutely agree with you. You hit the nail right on the head. As a Republican, as a conservative, I am for free market and I'm for deregulation. However, you can't do piecemeal deregulation. Healthcare is so highly regulated. It is not free market. It is a fixed price system. So that means that I can make adjustments, but the price doesn't change because the price is set by the government. The government sets the price of health care. Hospitals now are taking, of their patients that they see, 60 to 70% of those patients are in some way being funded by the government. Of the remaining market, 70% of that market is controlled by a single insurance company. And so it's not a free market. It's not a place where prices vary. The amount of money that's going to go in is the exact same. The amount where that money goes is the only thing that deregulation will affect. It won't affect what those prices are. And so you can't do a piecemeal regulation and think that you've improved the system. You know, I keep thinking of the government, and the government's putting a finger on one side of the scale, and then they're putting the finger on the other side of the scale to try and balance those scales a little bit, and that's what COPN does. It tries to balance the scale for all the other regulations that government has put in place that you mentioned earlier. Removing COPN, all it does is allows groups to come in. They can set up across the street from a hospital, a rural hospital, and they can cherry pick those patients that have good insurance, and that would have a devastating impact on our rural hospitals. Folks that are pushing for repeal say, hey, you know, we have a charity care contingent in there. Well, if you look at how charity care is done here, it's not actually that they provide care. It's that they pay a fee to the state. So they can still sit across the street, cherry pick, make a lot of money, and then pay just a portion of that money back to the state for the right to sit there and cherry pick. It's the government has its fingers on both sides of the scale. Removing one of those fingers doesn't make for a better system. It just off-balances the scale more.
You look at the hospital crisis in Virginia right now. There are hospitals in rural Virginia, and by the way, one is already closed and shut down because they couldn't make any money, and they have to provide services to people that are guaranteed to lose money. They're getting, 60 cents on the dollar for Medicaid, under that for Medicare, obviously. They have no choice with that. You have indigent care. You go to the emergency room. By law, you can't be turned away. The other thing is they have to provide services that they don't make any money on, that they're mandated because they're a hospital. So if you eliminate COPN so that my audience really understands this has nothing to do with free market economics or competition. Here's what happens. Profiteers come in to rural areas to basically only offer competition on the most profitable areas that the hospital has, like MRIs and things like that. So yeah, in the short term, your cost for that may come down, but that's the only source of income hospitals have in order to stay in the black or not too much in the red, because they have to offer all the free services. So I come in and I just offer the three most profitable services, and that's it. The hospital is getting hammered. And now we don't want to bail them out. Obviously, they're a private company. This is going to be a disaster in Virginia, and people don't understand. Because, look, Delegate, it's like Pavlov's dog, okay? It's like ring the bell, say free market, everybody salivates, get me a treat. This is not free market economics. Am I right?
That is correct. And if you look at the repeal bills that have been put in place, they're not... John O'Bannon's repeals all of COPN. Most of the other bills are just looking at single services, and the services that they're looking at are either surgery centers or they're looking at diagnostic centers, the MRIs and the CT scans. There's a reason why no one's out there saying, please repeal the COPN on birthing services. There is no money in birthing babies. They're asking for repeal just on those services that make money. And I think that speaks directly to what's going on here. It's not about free market. It's about an opportunity for a relatively small group of people to make money off of this and it's just looking at the diagnostic services, just looking at the surgery centers. People aren't out there saying, "Gee, I want to open up a freestanding trauma center," because it costs a lot of money to run a trauma center. And if you hit the hospitals on the surgery centers and on the diagnostic centers, they don't have the money to take and cover the birthing centers and the trauma centers.
Absolutely. Look, eliminating COPN is not going to improve healthcare in Virginia. It's simply going to allow, just like you said, you hit it on the head, a small group of profiteers to come in and cherry pick the most profitable areas that hospitals have. So a few people make money, everybody else gets screwed within the service of that hospital because they can't provide the services that you want. Look, Dr. Stolle, right now, there are certain areas in rural Southwest Virginia that you have to drive 2.5 hours to a trauma center. Now, you're a doctor, right? Life and
correct
death in that situation. 2.5 hours. You repeal COPN, it'll be 5 hours. It's insane.
Yeah, I agree. I think that my big concern with some of these is that we're actually trying to make this decision without any facts to back it up. People use averages. The Kaiser Foundation says in COPN states they can offer health care cheaper than non-COPN states. Yeah, but those are averages. Look at Virginia. Virginia's costs per capita are lower than 63% of the non-COPN states. We're 32 overall. We are a very low-cost state. On Medicaid, we're 48th on reimbursement out of 50. We already have very, very low costs. You're not going to take and see much price movement or any price movement with this COPN. So the hoped-for gains with this are just that, hoped for. There's no evidence or data to actually support this. And so I think that it's not a conservative thing to do to throw the baby out with the bathwater, to say, let's repeal it and see what happens. Let's see if we can't find some facts, get some information, and make a reasoned decision based on facts on what we should do with COPN. We set up a commission last year. We sent that group out, said study COPN, make recommendations on how we can make it better. They considered repeal of services, and there weren't enough votes to actually support repeal of these services. We are putting in a bill this year to reform the COPN. It's, as you mentioned earlier, it's 1083. It speeds up the COPN process. It adds transparency to it, and I think most importantly, it sets up an advisory council to come back and report to the General Assembly on those services that can be repealed and taken out of the COPN. And they have to set up specific criteria, analytic criteria, on how we're going to evaluate those services and what constitutes our ability to take and pull those out, so that we have actual data to know what will happen when we do it. Right now, we don't have that. I would love to repeal any service that does not improve access and quality of health care. We should get that out of there. But let's not repeal services not knowing what's going to actually happen.
Look, Dr. Stolle, that makes sense. So basically, your compromise legislation is to take a closer look at COPN, see what reforms might make sense without tongue-in-cheek throwing out the baby with the bathwater, right?
Correct.
All right. Sounds like I've nailed that. I know we're out of time. We want to thank Dr. and Delegate Chris Stolle for being with us. Sirens are going off, right? That means we have to. That means you have to be out of time. Hey, Delegate, thanks for being with us. Thanks for making a decision on your potential Congress run so quickly and so clear and so succinct. Thank you so much,
John. Thank you very much for having me on.